I'm Lakshmi, a medical physiologist and a teacher, and this channel has been created for physiology. So, to all those who are here to learn physiology, this channel is for you. And today we are going to discuss estimation of hemoglobin by Sahli's method. So, let's deep dive into the topic. So first of all, I'll say what is this hemoglobin? It's a protein, right? So hemoglobin, it's a protein made up of heme and globin, and iron is one of the important component of this protein. Now, what is a function? Functionality. See, there are many functions. One of them, which is very important, is transport of oxygen, transport of gases. So it also does the transport of oxygen from the lungs to the different parts of the tissues, and also transport of oxygen from the tissues to the lungs. So you will tell me that how much percent of oxygen is being transported by hemoglobin and how much percentage of carbon dioxide is being transported from this hemoglobin. So let's dive deep into the topic. So first of all, I would discuss what are different methods of estimating this hemoglobin. See, we'll discuss about different types of hemoglobins and different conjugations, different forms of hemoglobin in the upcoming classes. Today we'll discuss solely on the practical aspect of how we are estimating hemoglobin by Sahli's method. So before that, we'll see what are some of the methods which are used.
So first is your visual method. In visual method, what methods comes? First is your Sahli's method, then your Halden's method, then Dare's, Tolquist, Winthrop. So there are different methods which are used for the estimation of hemoglobin as a part of the visual method. Apart from that, we have gasometric method, and also we have something called spectrophotometric method. Spectrophotometric method. Under this comes two, which is your sign meth hemoglobin method. Sign meth hemoglobin method. Okay, just one will be your sign meth and number two will be your oxyhemoglobin method. So these are the two spectrophotometric method. Apart from that, we have other methods like alkaline hematine method, or we have comparator method or specific gravity method. Apart from that, we also have automated methods which are used in the labs, of course. So today we'll discuss about the Sahli's acid hematine method. Okay, so what is the principle behind it?
First of all, I'll talk about some advantages. This experiment of estimation of hemoglobin is very simple, cost effective. You don't need electricity or heavy equipments. It's very simple.
We'll talk about the principle. So what is the principle? See, whenever a weak acid or any acid is put into the blood, hemoglobin gets converted into acid hematine. Now this acid hematine is brown in color. Now upon dilution with distilled water, what happens that we have comparator. So we're going to compare this color with that of the comparator, and based on that, there is a tube, which is a hemoglobin tube. It is calibrated, so whatever marking it matches with that of the competitor will be taken as your hemoglobin estimation. So let's see what are we discussed the principles already. Now we're going to discuss about what are the requirements or what are the equipments. So for that we see this is your hemoglobin tube. This is your Sahli acid hemoglobinometer. Now this entire this apparatus, it consists of lot of equipments. So first of all is this is your comparator. You can see this is the front and this is the back. The back of the comparator, see, if you see, this is the back of the comparator. It is made up of some white fiber like thing which is attached. So light can easily pass through it and can give a contrast over the tube, over the comparator. Now if you see here, we have got two brown comparators. Can you see here? And this is the place where you are gonna put this tube. This is your hemoglobin tube. Hemoglobin tube, as you can see here, it is put inside the space which is made over here, and whatever color is there, it has to be compared. So whatever color you see in the tube, because of the acid hematine, you will see you have to compare it with that of the comparator. What other equipments here? First, we'll discuss about the tube, which is very important. This is your graduated hemoglobin tube. This graduated hemoglobin tube has graduations from two sides. It has got two different graduations. One starts from your 20 to 22 and it is in your gram per deciliter. This gram per deciliter is you for your hemoglobin estimation. The other side of graduation is in percentage and that estimates your hematocrit. So these two graduations are being used for two different purposes in the same tube. Okay. Now apart from that, we have this glass rod. This glass rod is called stirrer. Once you put everything inside this hemoglobin tube, for stirring purpose, you are going to put this glass stirrer inside the hemoglobin tube. Now, apart from that, we also have something called pipette. You might have seen different types of pipettes. Here, the pipette is, see, other pipettes you might have seen, which is your RBC pipette or WBC pipette. In there, what you see that we have a small bulb in the center. Hemoglobin pipette does not have any bulb. It is quite straight. Here is this is the rubber tube. This is your mouthpiece and this is your hemoglobin pipette. And it has only one graduation, which is over here. This one graduation that you see, it determines 20 microliter or 20 mmq. So this is the graduation. Now we will move towards the how to perform this experiment. So as you have understood what are the equipments which are required, which is your Sahli's acid hemoglobinometer. Apart from that, you need to have equipments for the sterile finger prick, that is gauze, spirit, lancet. Then you need N by 10 HCl. So the other requirement is your, I'll write it here, N by 10 HCl. This will work as the acid which will help in conversion of acid, hemoglobin into acid hematin. So N by 10 HCl, then you need distilled water, you need dropper, and rest of the equipments are already here, which is your comparator, stirrer, hemoglobin pipette, then your hemoglobin tube, and this everything is there. Okay. Now the next thing we'll discuss, we'll move towards is how to do the procedure. First of all, what you have to do, what you have to do, you have to take the dropper and open the bottle containing N by 10 HCl, and with the help of dropper, you will take out some amount of N by 10 HCl. Now you will take that N by 10 HCl and put it inside. You will put it inside this hemoglobin tube till what you have to keep, you have to fill it till the 2 mark or 2 gram per deciliter mark, and you always have to use the lower meniscus. Okay, so you keep it, then you put it inside the comparator, you just keep it, it will rest. Then you have to make a sterile finger prick. So making a sterile finger prick, take the gauze piece, spirit over it, then choose the finger. These three fingers are used for pricking. Then you will take the spirit and you will apply the spirit from center to periphery. Now why is it done? Because if you are doing the other way around or you are just rubbing it at all, what happens is that the dirt is going to stick to one area or will come from periphery, it will remain in the center. Since it's one finger, you can make one wipe, but if you are making some finger prick in other areas, then you are supposed to always move your gauze piece from center, or the cotton piece from your center to the periphery. Okay. Now once you did that, let the spirit dry. If it is not dry, the bubble will not form. Bubble of blood will not form. So once it is dry, take your lancet, make a bold finger prick, bold enough for the blood to come out, not only the tissue fluid. Once you saw the one drop of blood, take a cotton piece, wipe out the first drop of blood. Now this is very important step. Why you are supposed to wipe out the first drop of blood? Because it mostly contains the tissue fluid. So you are supposed to wipe it out. Now once it is done, apply very gentle pressure so that one drop of blood will come. One big drop of blood is there. Now the next thing that you will do is you will take your pipette. So for example, this is your hemoglobin pipette, and till here is a marking of 20 microliters. Okay, the 20 wala mark is over here. And see how you are supposed to do the pipetting. Always utilize gravity. So, for example, this is your one drop of blood and this is your pipette. So, your pipette should always be slightly in the down position so that with the help of gravity it will automatically slide into the into the pipette, and the tip of the pipette should be submerged. It should be immersed inside the drop of blood, and you are not supposed to lift, or you're not supposed to put the pipette up. If you lose any contact between your uh, tube, between your pipette and the blood, what will happen? Air bubbles will get filled inside, and that's a problem. You can't proceed with air bubble because it's gonna give a false value, a lower value. So once you take the pipette, once you take blood till 20 mark, what you are supposed to do is that take a piece of cotton and wipe the tip of the pipette from back to front. Now, why are supposed to do this back to front? Because if you're doing it the other way, or if you're keeping the cotton over the tip, what will happen? It is gonna absorb all the plasma, and only the cells will remain. So your fluid will become concentrated, and you will get a higher value of hemoglobin. Now, or you are going to lose cells. So you should be avoiding this thing. Once you do that, what you are supposed to do, that now what do you call? We have this hemoglobin tube. Now, put this hemoglobin pipette tip into the hemoglobin tube, where this N by 10 HCl is over here. So this pipette has to be kept inside. The tip should be touching this meniscus of the N by 10 HCl, and there you have to blow all the blood samples inside this N by 10 HCl. So after doing this, you have to do a very important step, and that is rinsing. Now, what is rinsing? Once you are keeping this blood sample into the N by 10 HCl, keep the pipette till here only, and after that you try to just blow the air in and out twice or thrice. So around twice or thrice rinsing is required so that proper mixing is done. Once it is done, and you make sure that all the every blood sample or any fluid is out of this pipette and it is inside this hemoglobin tube, just safely take it outside and just keep it aside. Now, take this flattened glass tube or the stirrer, and the flat part has to be below or downwards. Now, just keep it inside the tube, hemoglobin tube, and just stir it once or twice, and then after that you can just let it sit and rest for around 8 to 10 minutes. This 8 to 10 minutes of timing is very important, because in this 8 to 10 minutes what happened? So okay, this 8 to 10 minutes is very important, because this is the time which is required for the conversion of hemoglobin into acid hematine. Okay, once this is done, what do you do? That you keep it. How you are supposed to keep this? See, this is your comparator. This is your hemoglobin tube, and on the top of that you are keeping the steroid. Now, very important thing, that you are not supposed to take the steroid out of the tube at any cost, because you're going to lose cells, you're going to lose your hemoglobin value. You are not supposed to take the steroid out of the sample. Now, this is the steroid which is not over here, but it should be there. Okay, so once it is done, obviously initially the color will be very concentrated. It will be very dark brown as compared to this comparator. So you will take dropper, add few drops of distilled water. So what you will do, that you will take few drops of distilled water with the help of dropper, and you will put it inside the hemoglobin tube till the time the color matches with that of the comparator. So you don't have to just add many drops at a time. It should be 1 to 2 drops at one time, till you reach a level where this comparator is matching. the place where this comparator matched with that of the this hemoglobin, the fluid inside the hemoglobin tube, the colored matches with that of the comparator, it will give you the value of your hemoglobin estimation in gram per deciliter, and always measure the lower meniscus. That will be your accurate value. Now, this is how you are gonna calculate it overall. One very important thing that I would like to add is that how you are supposed to look while you're comparing. So I don't have the equipment right now, but I can use this. So for example, this is your hemoglobin tube. Okay, the hemoglobin comparator. This is your hemoglobin tube, which is over here, and just for imagine that this tip is acting as a stirrer. Okay, so whenever you are doing the comparison, always keep the stirrer up, because if into the tube stirrer is still there, what will happen? It will look darker or lighter? Of course, lighter. So in order to avoid the effect of that glass rod in the comparison, you will always lift the stirrer above. Now what you're supposed to do is, with the help of two fingers, you hold a comparator. With the help of one finger, you hold the this hemoglobin tube, and with the help of another finger, you are gonna keep this uplifted stirrer, and you will just keep you will hold it like this, and with the and one arm length in the bright light, you are gonna see in the horizontal line, and you're gonna give the measurement whether it's matching or at what level it is matching, and that is gonna give your hemoglobin estimation. So this was all about how to estimate hemoglobin. I would also say that what are the advantages? I've already said, it is very inexpensive. It can be done without electricity, no major equipments required, easy, convenient. If we talk about the disadvantages, I would say that since it is a visual methods, the perspective of different people might change, so it is quite inaccurate in that sense. For some people, it could be matching. For some people, it could be lighter. So some degree of variation can be there. Apart from that, um, the
The comparator has its brown color, right? So that brown color might fade with time, so that is a problem. Or the light is not coming properly into the comparator, so it might give a false value with the help of that also. These are some of the advantages. It's not very accurate since it is a visual method, and it can also change from person to person. So these are disadvantages. You already know the advantages, so let me know if any doubt is there. Till then, just wait for the next video. So